Hello, I'm Dr. Nalvlet Thompson, endocrinologist with Holy Cross Medical Group and member of the South Florida Community Leadership Board for the American Diabetes Association. Thank you for joining this educational program in support of Holy Cross Health's executive team for the STEPOut Walk to Stop Diabetes on October 16, 2021. In the next few minutes, I hope to make the case for why we should all learn about diabetes, know our risk, and do whatever we can to fund research to prevent and cure diabetes and improve the lives of all people affected by diabetes. Did you know that in the United States, every 21 seconds, someone is diagnosed with diabetes? Nearly 1 in 2 American adults has diabetes or prediabetes. The primary types of diabetes are type 1, in which the immune system destroys the insulin-producing cells of the pancreas. In type 2 diabetes, often commonly associated with obesity, the individuals are resistant to insulin and the body is unable to make enough insulin to meet its needs. Gestational diabetes, which is diabetes occurring in pregnancy, the body cannot make and use the extra insulin it needs for pregnancy. This usually resolves after delivery, however, may return with future pregnancies. We're currently seeing an epidemic of diabetes in our young people. Nearly 18,000 youth are diagnosed with type 1 diabetes annually in this country, and nearly 200,000 young people in America have diabetes. Largely to obesity, we're also seeing many more cases of type 2 diabetes in our young people, with more than 5,000 cases a year of type 2 diabetes in this age group. All communities in the U.S. are affected by diabetes, but we're seeing particularly increased prevalence of diabetes in the South, with 11% or more counties with diabetes, largely in South, which includes South Florida. Diabetes increases the risk for more serious health problems, and these include heart disease, kidney failure, amputations, stroke, and blindness. The American Diabetes Association has made available many resources to help individuals diagnosed with diabetes. There are reference resources such as a self-care manual for type 1 diabetes. There's also lots of information available for individuals diagnosed with type 2 diabetes, including navigating nutrition, stress, emotions, physical activity, and preventing complications. The American Diabetes Association also provides extensive resources on diet, food, recipes that one can access through their websites. This is listed here. It's important that all of us assess whether or not we have risk for diabetes, especially if one has a family member or other relative with diabetes. And the ADA has made available a risk assessment tool that's available for free online that everyone can take to assess whether or not they have diabetes or prediabetes. I want to thank you for your attention, and we look forward to you joining us for the virtual STEPOut Walk to Stop Diabetes on October 16th. Thank you for
Diabetes, it's a complex endocrine disease that attacks different systems. One of the systems that attacks is the circulatory systems. Patients with diabetes have what is called peripheral vascular disease. But in addition to that, they can attack your nerves. And as a consequence, you have peripheral neuropathy. So the ulcers that happens in diabetes happens by 2 or 3 mechanisms. One of the mechanisms is peripheral neuropathy. Because of the diabetes. You don't feel that you have an ulcer, and you come with an ulcer that it is very advanced and infected. And in addition to that, because of the lack of circulation, it's very easy to get infected. Any kind of ulcers that don't have any circulation, then it's easy to get into the bone and get infected. And the other mechanism is the barotrauma. Patients with diabetes have special deformities in their feet because of the chronic diabetes. So they have trigger points in the bones on the feet that are easy to pressure and become an ulcer. So because of that, every time you have to go to the doctor, check your feet, the better your glucose is, the less chances of complications are. There are several measurements that we can't address that or prevent that. First of all, you have to go to the doctor. Check your blood glucose levels, your hemoglobin A1C. Make sure your numbers are correct. Make sure your circulation is correct. Every patient who has diabetes has to have an arterial circulation study to make sure the circulation is okay. The hyperbaric oxygen therapy, which is part of a complemental treatment for diabetic foot infections, yes, it's indicated when the patient has bone infection or a wound that is very extensive. So it's a complementary treatment that we use with antibiotics, also with hyperbaric oxygen patients. There are several studies that shows that the more physical activity that you do, the less complications you have. Check that with your doctor, with your physical therapy. Another thing that is important for all my patients with diabetes is use proper foot care, proper devices that doesn't increase callus formations or anything like that that will lead to an ulceration. Those are major tips that I can suggest to my patients with diabetes to avoid any wounds in the future.
Hi, my name is Dr. Ryan Kunstad. I'm an endocrinologist with Holy Cross Medical Group. Today I am going to give a brief overview on some of the common diabetes medications I use in my practice, and along with other primary care doctors and endocrinologists, these are medications we use commonly. So I just wanted to provide an overview and some basics on these medications. So the first common medication that most primary care doctors and endocrinologists utilize for diabetes is metformin. So metformin is first-line therapy. We use metformin in combination with, we tell patients that to get regular physical exercise, to reduce their sugar consumption, reduce their carb amount. But metformin has multiple mechanisms. It's been around for many, many years, this medication. It works on the liver and it actually decreases some of the glucose production in the liver. There's a class of medications called GLP-1 agonists, and most of these are injectable medications. Most of them are about once a week, and some of the common names of these medications are like Victoza, Ozempic, Trulicity. But one of the main ways that they work is actually increase the amount of insulin that we produce when we eat, which in turn does help lower our blood sugar. And then another medication class that has been very commonly prescribed within the past 5+ years or so is a class called SGLT2 inhibitors. And these are like, just some examples are Invokana, Farxiga, Jardiance. And again, probably heard of these on TV. They're not generic. And the way these medications, their mechanism is actually you increase the amount of sugar that you release and excrete in the urine. So that actually in turn lowers your blood sugar in the blood and helps improve diabetes and A1C. And so these medications, they actually also have cardiovascular indications. So they help for patients that have a history of heart failure, may reduce risk of hospitalization for heart disease. And they also, the newest thing is that they may prevent progression of chronic kidney disease, which is a very common condition that we see with diabetes. There's another class that we use as well. This cannot be used with the injectable class. The medication class is called DPP-4 inhibitor, and these are like Januvia and Tradjenta. There's a class that's been around for a very long time called sulfonylureas. And just to give you some examples, these are like glipizide and glimepiride. And these medications, unlike some of these other medications I mentioned before, which are weight negative, these can be weight positive, so you may gain a little weight with these medications. And they do work. They're effective for diabetes. They actually work by you increase the amount of overall insulin that you make all the time. So one of the risks that we see with these medications is sometimes they unfortunately can cause a low blood sugar or hypoglycemia. So that's something that we have to contend with that medication. But if we're not meeting goals with some of these medications, then unfortunately we're at the point that we have to add insulin. And insulin's a hormone, and so that's something that we would prescribe, which can be used in combination with the medications that's above. And there's different types of insulins. There's short-acting insulins. that work very quickly that you want to take prior to meals. There's intermediate insulins that last for 12 to 18 hours, and then there's longer extended release insulins that can be 18 to 24 hours in duration. Metformin is a safe medication. It's been around for a very long period of time. For patients that have underlying chronic kidney disease, sometimes we have to scale back on the dosing of metformin, or even if someone has worsening chronic kidney disease, it gets to a point we actually have to stop metformin because there's an increased risk of this severe condition called lactic acidosis. If someone comes in that's overweight or obese from diabetes and making a lot of poor dietary choices, and we start a lot of medications to begin with, and things get better, like the blood sugars improve a lot, A1C improves significantly, we can scale back on medications. It's oftentimes that someone may get started on insulin and they lose a lot of weight and they make a significant change in their lifestyle, and we can pull back on medications and reduce that. So it doesn't make you dependent necessarily. With more and more technology out, and as we see all these new commercials for diabetes, I get questions about wearing a glucose monitor, something called a CGM, or continuous glucose monitor. So these are valuable devices that gives you real-time information about where your blood sugars are. And more of the time we use them for insulin-dependent patients when we're having to adjust insulin. So because I'm adjusting the insulin, the dosing based on the trends I'm seeing, if the patient's having highs or low blood sugars. So those are very valuable. It's very valuable technology that we didn't have years ago that gives us real-time information. And when someone comes to the clinic, we can see all their numbers in front of us and get an idea how we can adjust their insulin safely. Thank you so much for your time, and we are happy to help in any way we can, and if we can be of any assistance, you can call the Holy Cross Endocrinology Department. We'd be happy to see you. Thank you so much.